Great. Okay. Well, thank you for coming. This is really a pleasure to be able to present to your committee. I'm Professor Jonathan Patz from the University of Wisconsin at Madison. I'm the professor for this course called Health Impact Assessment of Global Environmental Change. And part of this was these projects that are part of the University Alliance at the university, and within that is the University Year, with the C, University, and it's part of that is that courses come to work with the city, and Monona is the city for this year. So I have two students from the team that did the Health Impact Assessment on Transportation. We have Maria Castillo and Lauren Peretz representing the full team there. So take it away, Lauren and Maria.
All right. Thank you guys so much for being here to listen to our presentation. So we did a health impact assessment on a Going for Silver report, which is already created. So like many suburban areas, Monona is laid out in a way that's meant for transport mostly by cars. And a lot of the infrastructure and programs and policy are not really adequate to support active transport. The residents of Monona have expressed this inadequacy and also desire for improvement. As the survey results that are shown up here, they found that city sidewalk systems and bike and pedestrian accommodations were among the top 5 services that had the biggest gap between perceived importance and perceived quality. So basically, people think they're very important, but they don't think the quality is as good as it should be in Monona right now. So one of the ways that Monona would like to change this issue is to increase the bikeability of the city. Currently, the League of American Bicyclists only gives Monona a bronze rating, but the city would like to improve this rating to silver. Therefore, a report titled Going to Silver was created to provide recommendations for increasing bikeability in Monona. But this report that was done lacks a health component. So what our purpose for our project was to provide that health component and to address the health outcomes through a report and conducting what's called a health impact assessment. So in addition to biking, after we looked into the health impacts a little bit, we also decided to include walkability of the city and just general active transport due to all of the potential health benefits that could arise from considering all of the active transport. They're supposed to be done. So one of the things we did at the beginning was we just looked for all the different stakeholders that are going to have some kind of stake in the decision-making process, or from the various departments that will do the engineering, the people that will decide on the budget, the police that will be involved with enforcement, and you all that are here today. So throughout our report, we kind of use these 2 separate models. So this one up here is, this is a county health rankings diagram. So as you can see here, they look at many different aspects of health on there. And 80% of health is attributable to factors that are beyond just clinical care. So this could be considered behavioral, such as exercise, as well as transit in relation to one's physical environment. And this concept is easily translated into the social ecological model that you see here. So through this, you see that we're not just looking at the individual factors, but we're also looking at environment and various policies, etc., that all contribute to health and all contribute to how much people will use active transport. So the next step of our analysis was to assess the broad health effects of biking and physical activity, which we will now give you a brief overview of. So one of the biggest things, and often most obvious, is that obesity and many other diseases are related to active transport and exercise, physical activity in general. So increasing the bikeability of the city would result in decreased cardiovascular disease, decreased hypertension, decreased diabetes, decreased obesity, and even some cancers. Approximately 250,000 deaths per year in the U.S. are attributable to a lack of regular physical activity. And the estimated medical cost of obesity in the U.S. was $147 billion in 2008. So that's like a huge cost that could be reduced if we increase physical activity. Active transport, which includes walking, bicycling, etc., has been documented as a way to increase this physical activity. And through this activity, you can reduce these morbidity and mortality rates, such as all of those that are listed here. So we looked at one study that was done by a Finnish research team, and that investigated through a randomized control trial the effectiveness of biking to work, which found that physical fitness in general results in better cardiorespiratory health as well as better metabolic fitness, and that cycling especially was very effective, even more so than increase in walking.
And if you use that front tire, I imagine you are really fit. Sorry.
Couldn't resist.
So for the mental health and well-being, we found that casual and informal social relationships that contribute to the social capital in a city are reduced in environments in which people spend more time driving alone in cars and where there are fewer opportunities for face-to-face interactions with neighbors. So while physical activity has many physical, mental, and social benefits, walking was found to have more correlation with the mental health and social well-being. So walking attributes affect the psychosocial variables that influence walking as a means of transportation, while access to parks and recreation influence the psychosocial variables that influence walking for leisure or recreation. And walking as well as social support highly increases the physical activity and walking as a means of transportation. And this is especially important for older populations because if they have more social support, they will be more encouraged to do biking or walking. And also there is a correlation between the perception of a neighborhood as being safe with a higher sense of community. And the air and noise pollution, so vehicles emit pollutants from the gasoline and diesel combustion that are detrimental to both human health and the environment. And it is well known around the world, many studies have shown that these vehicles emit carbon monoxide, nitrogen dioxides that are regulated by the EPA as they have a maximum ambient or outdoors concentrations. And that is because there are studies that have shown that increased pollution and vehicle exhaust contribute to cardiovascular diseases, mental health problems, maybe dementia. Some studies have shown that there may be a correlation there. And as noise pollution has been less studied, but the European Society of Cardiology found that adults living in the most polluted areas of the city had a 6% increase in developing high blood pressure, so hypertension. And another study in London in the School of Hygiene and Tropical Medicine concluded that deaths and strokes were 4 and 5% more common respectively among adults in areas with daytime road traffic due to cardiovascular disease, sleep deprivation, and more stress.
So lastly, we looked at injuries. So bicyclists face a higher risk of crash-related injury and death when compared to motor vehicles, even though only 1% of all trips in the U.S. are taken by bicycle. In 2013, over 900 bicycles were killed, and an estimated 494,000 emergency visits were due to bicycle-related injuries. Data from 2012 shows that fatal and non-fatal crash-related injuries to bicyclists in the U.S. resulted in lifetime medical costs and productivity losses of $10 billion, and this is in the year of 2010. Of those admitted to the emergency room for bicycle-related injury in 2009, the most common injury was bruising and intracranial head injury, and the most common for emergency room patients, the most common for the emergency room patients was the intracranial head injuries. And in 2009, 10% of all injury-related emergency room visits also involved motor vehicles. So, yet it is important to note the effective preventative efforts that exist, both at the level of the individual. There still needs to be more like choice and action towards preventing these kind of injuries. So after investigating these broad health impacts of biking and physical activity, we then moved on to assessing the recommendations in the Going to Silver report. And these fell into like these 5 different E categories, and then we also added another E of equity, which should be considered in all 5 other E's.
So one of the issues with the Going for Silver report is that they focused their recommendations more on what they saw in the community. But what we did was look into studies that were done around the world and compare as how this could be applied in Monona and what similar impact it could have here. So there are multiple education recommendations, but they all have different impacts. And some of them haven't been studied too much. Some of them have neutral results. So, for example, the Safe Routes to School program, it has been mostly focused on increasing walking. And there are one study that is on a project in 10 schools in California showed that all of them increased their rate of walking, but not the one of biking. But another study in California as well, in Marin County, found an increase in 114% in the number of students biking to school. So there are studies that show different results, but they are mostly positive. And a program in Sydney showed an increase in 56% of participants bicycling with higher frequency just after 2 months after the Safe Routes to School was implemented. And even though Safe Routes to School is focused on kids, it also improves the infrastructure with may encourage adults to bike as well. Cities such as Copenhagen, Berlin, Portland around Europe and the US have all established mandatory bicycling education for all school children and or educational and marketing events year-round, which also include like giving away maps, biking maps for everybody so that they are more well-informed. And these are the cities that have the highest rates of people biking and walking to school. So that's what they have found effective. And also the education and benefits of physical activity as one of the components could help address the prevalence of the impacts of an inactive lifestyle, such as childhood obesity.
So the next C was encouragement. So encouragement is a very essential component to increasing walkability. If people don't feel encouraged to bike, infrastructure, policy, regulation, that won't really matter that much. So while there are occasional biking events in Monona, the city currently only receives 2 out of the 10 stars available for encouragement, according to the American League of Bicyclists. And so some of the recommendations in the Going to Silver report involved mass community cycling events. Unfortunately, the impacts of these events are rarely evaluated in the long term, but those that have been have very mixed results. Mixed results in increasing physical activity. But what's more consistent in this research is the feeling of increased social cohesion. So this means like feeling like you're part of the community, which, as Maria already mentioned, has very positive effects on mental health. Additionally, studies have shown that these events can increase perceived bike level skill, bike skill level. This gives people more confidence to bike, so then they're more likely to do so if they feel like they have the ability to bike. So another recommendation was the bike to work days. And these kind of have similar results to the mass community events. They increase short-term biking, like on the day of the event, a lot of people participate, but in the long term it doesn't really change behavior as much. But there was one study that was done in Australia where they decided to combine the mass cycling events, the bike to work with education, and they had much more successful results. They saw increases in cycling frequency, physical activity, and social cohesion were all reported. So if you make the campaign more long-term instead of just these one big mass events at a time, you're much more likely to get significant results that lead to positive health outcomes. So the third E was enforcement. So as defined in the Going to Silver report, enforcement refers to the law's regulation and overall role of the law enforcement in the community to support healthy, active community initiatives in the city of Monona. So the city of Monona currently only gets 3 out of the 10 stars in this category. And both more cycling and greater safety are observed in environments with better and more infrastructure and pro-walking, bicycling policies and programs. Moreover, a correlation has been found between feelings of personal safety and the number and the percentage of weekly trips taken by bicyclists. So there's this idea of like the safety in numbers. So this seems to hold true in the research that we've done. Studies have shown that the higher levels of bicycling have greater bicycling safety, and that bicycling efforts which used mixed zoning standards, public snow and ice removal, and non-mandatory bike registration systems have improved this overall safety in numbers. So the Going for Silver report suggests outline driving and parking in the bike lanes and implementing standards of bike parking, providing end-of-trip facilities, and creating a bicycle advisory committee that also involves the police department. And these are likely to have positive effects both on the amount of bicycling as well as health.
So in the Going for Silver report, they stated that some corridors or streets needed in red, the road needs to be improved, and then the crosswalks is the light blue here in these small points, and then sidewalks, these places are lacking sidewalks. In the green is lacking repavement, and in dark blue it needs bike lanes. And this is an important part of Monona because as we know, it is around the lake, and in the survey that we did in 2016, one of the most common answers as of why people were biking is because they enjoy the scenery. They like to bike along the view of the lake. So this has the potential to attract a lot of bicyclists and pedestrians, but it also has high traffic. So even though it is not officially a bike route, but a lot of bicyclists from Monona, from Madison and from around Monona use these streets to commute and just for recreation.
So could you clarify what you're saying in that graph there is? So the red, where it's red, what are you recommending?
I think it was either the speed limit or that's where the bikes are going, where there's no in the side but just a bike lane. So bicyclists are riding right next to the cars and they feel unsafe.
Okay.
So you're recommending road changes
Yes.
there, and in the yellow you would be saying add sidewalks
Correct.
here, and, okay.
So studies in London have shown that increasing the quality of the roads automatically increases the perception of safety and increases the number of bicyclists. Separated bicycle facilities, such as the bike tracks or side paths, is like this. It's a physically separated bike lane. And a study in Copenhagen demonstrated that by adding this infrastructure, the bicyclists increased in 20%, while car traffic decreased in 10%. The traffic calming devices, such as bump speeds, it has shown that if cars reduce their speed, bicyclists will feel safer and they will ride more. And this was also shown in the survey last year, because a lot of both pedestrians and cyclists said that they were very afraid of riding next to cars that were going too fast, on that they just didn't want to let their kids go out if that was the situation. And the complete street policy, even though the US, the federal government, has been trying to implement, has been thinking about it, there are not enough results at this point that show any sort of results up to date. The road diets is what you can see here in the picture. So before, if it is 2 lanes to each side, in each direction, afterwards what you do is you cut 1 line on each side, and you create this one in the middle that people can turn there. And this has also shown an increase in pedestrians and bicyclists, also because for pedestrians to cross the street, not only to walk along the sidewalk, but also to cross the street, they feel safer and it increases the numbers. And the bike boxes are the green boxes that are sometimes either in front or right next to the cars. They are supposed to give bicyclists a head start so that they can be seen by the drivers, but it didn't really increase the number of cyclists, but it did increase the perception of safety, which is also associated with both sometimes increasing numbers, but also with social capital and a safer community as a whole. Those were the recommendations from the Going Full survey, but besides those recommendations, we decided to add others that we found often in scientific reports. So adding sidewalks, for example, present an opportunity for increasing the safety conditions and the connectedness of the streets. This was also something that a lot of people said in the survey. Then sidewalks, it was found that older adults are more likely to be sufficiently physically active if local facilities are available and accessible to them. And also, as well as older adults, youth are more likely to go to a recreation site, such as parks, and be physically active there if they can bike or walk to the site, which presents a double opportunity of kids biking and making exercise in the park. And finally, studies have shown that the more sidewalks, bike lanes, and also stop signs, so signage, at intersections create a more walkable and bikeable neighborhood and increases traffic safety.
So the next idea that we added is equity, and it's just important to consider equity in order to implement all of these recommendations in a fair way, and to consider all of the inequities that already exist in Monona and potentially like inequities that could be made worse by some of these recommendations if they aren't implemented appropriately. Therefore, equity should be considered in all 5 E's and in really any kind of policy or infrastructure, et cetera, that you put in place. So one study found that low-income people, women, people with children, and elderly populations were much more less likely to participate in cycling events. And so the city of Monona is 94% white and is relatively well off, especially when you consider income compared to national and state levels. But there are still, when you break it down, especially by race, there's very significant income inequalities in the city of Monona. And this is, like I said before in that other study, the low income was linked to decreased cycling rates. So that's something that you need to consider reaching out to all the different populations of Monona, especially minority and low income areas. So the Race to Equity report conducted in Dane County shows that there's numerous health disparities between blacks and whites within Dane County. For example, blacks are 3.2 times more likely to die from diabetes than whites in Dane County, and this is a disease that could be partially combated by increasing active transport. Therefore, Monona needs to make sure to target low-income and minority communities. And additionally, Monona has a very high elderly population. The elderly population is, or the population over 65 years old is almost 20%. So there needs to be programs that specifically target the elderly, and when we're putting into place various infrastructure and programs, you need to be considerate of the fact that many of these elders have physical impairments. So that's something that should be considered in all of these.
So we have mentioned multiple physical, mental, and social co-benefits from active transportation, both biking and walking, but we also know that there is a cost associated with this. So many studies around the world, including one in Madison in 2012, led by Maggie Grabo, they studied the 11 most populated cities in the Midwest, and including Madison. And so the study was what was the case if 50% of short car trips of 5 miles round trip or less were replaced by biking. They found that just reducing the car trips to any active transportation had multiple monetary gains, but biking had the most benefits because it increases the physical activity and it also reduces air pollution. So air pollution has costs associated because it decreases not only the health, it has health detrimental, but also for example, it damages property and it creates monetary losses there. The study showed that per bicyclist per year there was a gain of $2,000, and in suburban Madison there was over 65 million in annual saving in the entire suburban Madison, with 12 lives saved and 19,000 people who benefited from this, both from the benefits of the people who are biking and walking, but also from the other people surrounded, from increased safety, decreased insecurity, and the pollution. So in conclusion, it can be said that the benefits of active transportation far outweigh the cost.
Can I just make an addition there that those benefits, the 50%, the half of the car trips turned to bike trips is only for the summertime. So those benefits come from only 4 months of the year. So you don't have to be thinking about biking in the wintertime. All that is across 4 months' time.
Is that like 3 miles and less, or what do they count?
It's
5 months.
4 kilometers though.
So
So
4 kilometers.
So
for
for
8
each way.
kilometers
So-
round trip or 5 miles round trip. So 2.5
see.
miles each way.
Yeah. Okay.
And we know that one of the reasons people don't bike in Monona is because of the winter. So
Yeah, that was the top reason reported.
I don't see why.
So in addition to these the costs and benefits of bicycling, we also need to consider like barriers that might make it difficult to implement many of the recommendations that we have for you. So one of the barriers might be, what we saw in a lot of the studies was that there's like this initial hurdle of encouragement, kind of getting people to change their lifestyle a little bit and feel encouraged to start biking. But as we saw in survey data that was conducted in 2013 in Monona, people, most of it was like open response, and people again and again on all the questions were saying that they wanted better bikeability and walkability in Monona. So it's something that people really seem like they do want. So we think that it might be a little bit easier for Monona to overcome that hurdle since the desire is so high. And another barrier that we heard from our client was that there is a lot of pushback from homeowners that will have to have sidewalks put in front of their houses, especially, and potentially also people being upset about some of the parking that might have to be taken away to form bike lanes and more area for the sidewalk. But once again, it seemed like, although like these challenges are going to arise from that 2013 survey data, people really want this in Monona. They would, it seems like, prefer to have the infrastructure and the policies so that they can have active transport and do so safely. And lastly, a major issue to any project is cost. But as Maria just told you guys, there's such a large benefit to active transport in both health and air pollution that these benefits far outweigh the costs.
So we would like to recommend prioritizing the ease. So even though enforcement is usually recommended to be first, we found that there are so many recommendations in the engineering section that this should be prioritized. But we also want to emphasize that equity is really important and it has been tackled at every single step of the pyramid. And so, for example, engineering, if there are interventions on infrastructure in certain areas, this should also be tackled in those communities that would have more difficulty accessing active transport. After engineering, we could recommend going with enforcement because only then people will feel safe and they can take advantage of the infrastructure changes. And then third, it will be education and encouragement, even though they're technically two different E's. As Lauren said at the beginning, they are more effective if they are together. Education, encouragement, and equity, the three of them. And finally, evaluation. Evaluation is an E in the Going for Silver report, but we didn't study this section because this is more, this should be done by the city and periodically. And every city has different ways to evaluate this, but we would recommend implementing surveys after each of the education and encouragement campaigns. This will help the city notice how community members feel about it and make some changes as needed. And we also recommend creating a communication plan. So at meetings, people can share their ideas, give community updates, installing bike counters, like the ones that they have in Madison, or doing ridership counts every year to see if there is an increase. Well, as a conclusion, we just wanted to say that active transportation as a whole has multiple co-benefits that we could take advantage of, and Madison is a great example that is already a silver community.
No, it's platinum.
It's platinum, and Monona is silver. No. It's
bronze.
Yeah. Going for silver. So there is a lot of great examples from Madison that we could look at too. And increasing the active transportation environment in Monona would not only help Monona residents, but it would also attract more people from the surroundings, people that would like to move in because there are better conditions, and especially for the kids. If they know that the kids are going to be safer here in Monona, they maybe want to move here rather than go to other places. And we just wanted to thank Dr. Jonathan Patz and Brad Burnham for all the feedback and support, and the entire University Year project, as Dr. Patz said at the beginning, for giving us this opportunity.
Very good.
Right, thank you.
Questions?
I already asked all my questions.
And you can get this report. It's
Yeah, we're gonna work
very
on, we're trying to like format it nice for you guys.
that's
So we're not familiar with the program, so it's been a little rough, but
But
we're
it has
working on it.
figures and all the references. There are over 150 references from studies. So
So is this report not in presentation format, correct? It's a report, like technical report format?
Yeah, well,
it
Kelly
could be.
just sent us the
Oh.
The latest.
the like thing.
So it would be more like a presentation slides, set of slides. and
Oh,
stuff.
no. It's just like some.
Paper.
It's like a paper, but they're trying to make all of the reports like kind of uniform. So we're working on trying to get into the template, but we tried and we're not super familiar with the
But
program. so.
there is a report
Yeah,
now.
there's a report.
So this is
It's
all
done.
within it's a health
Document.
impact assessment report
Document.
written up with references and figures.
Mhm.
So that can be handed to you.
That would be really fine.
But then there's also this trying to
Well, we-
uniform.
And
Yeah,
did,
we figured
uh,
if you wanted to put it on like your website or
Yep.
something, it'd be better to have the
Yep.
the one that's
Did Kelly get a hold of you and there was a person that they had hired on that would troubleshoot those?
Yeah, but well, they're not gonna do that themselves anymore because it was taking too much time. But we figured we may try to help a little bit.
So I would recommend passing that on to me, and we will pass it on to our city administrator, and we will make sure that they do that.
So we can just give you the report.
Yep.
Sweet.
As it
And the
is.
template.
And the template, yeah.
I think that we spent enough for that to be a product of,
Yeah.
of this.
Sweet. All right. Guess I don't need to learn a new program then.
Well, I think that the two of you were at the presentation that I attended on the campus last week, but I just want to say again, thank you, and as you noted in your presentation tonight, you know, there's so many things that people want to see in this community, but as is the case in any community, the resistance to change is hard to overcome. And so we talk about being a more sustainable community. We are an active community. We are a community that is getting younger. And though we also want our people of all ages to be healthy. And so your presentation helps remind us of all of the things that should motivate us to fight to make this a better community. So I thank you for that.
Thank you for the opportunity.
I have, go ahead.
One of the things that you mentioned was the disparity between higher income and lower income and the poverty factor here in Monona. Can you share anything more about the data? You know, are there certain areas? Are they are people who are would maybe benefit for a little more from more education or opportunities that we can provide located in our multifamily housing areas? Do you have that information, or is that something that we should look at more closely?
Yeah, so all we had was the census data, and that just broke down income by race. And although Monona is majority white, the Black and Hispanic populations of Monona make significantly less, like it's less than half per capita income. So, yeah, that's mostly where that came from. I think you can break it down by census tract if you know the neighborhoods.
Okay.
We
That's
have
not
that.
something we did. Okay, you do have that. Okay.
Would any of that be benefited by some of the locations they identified on that map?
We have to take a look at it.
That, okay.
Our GIS project, which I'll have for you at the next meeting, could parallel with this fairly decently. They broke down their destination planning and interconnectivity analysis by census tract.
Okay.
So they couldn't find derived neighborhoods in the city because it's kind of difficult in Monona. We don't have wards, so those kind of things where it's much smaller than a census tract. But it works so well for what they did. So that'll be explained at the next meeting, but we can
Okay.
correlate that with this
Good.
project.
All right.
Something too that's maybe somewhat unique about Monona, because it is such a small city, and because we have such a long lake shore, and obviously houses on the lake, and then houses across the street from the lake are significantly higher in value, and often therefore the demographics of the lake shore are just different from the demographics a half block away. And then when you get 5 blocks from the lake, I mean, it's like that often near Lake Michigan, you know, where like the proximity to the lake shore has a profound impact on the socioeconomic, yeah, and so it's, whereas you could go out in Madison and find neighborhoods the neighborhood has a socioeconomic character to it. Monona is just the lake shore. It's almost without exception.
Isn't another pattern too that you have apartment buildings along the big roads?
Right.
More or less along the big roads and close to,
Public transit.
yeah, and also close to often low-income jobs in like restaurants
Shopping.
and service.
Yeah, so, putting in some bike lanes and sidewalks and making sure you have good transit from those areas to other areas throughout the city or even to Madison could definitely help a lot with those communities.
So I have 2 quick things. I think that it's important to note, for whether they can hear me on the recording or not, that this is not a cost-benefit analysis. It's specifically associated with health. And then that brings me into my next part. Did you find anything associated with improving biking and walking networks in terms of engineering that actually negatively might impact a certain population's health? And the thing that comes to my mind is adding a sidewalk in front of an elderly person's home. For 4 months out of the year, they are able to benefit from it. And for 5 or whatever, 6 months out of the year, they're able to benefit. For 6 months out of the year, it actually becomes a monetary burden or a health burden because they have to shovel it. I didn't know if maybe there was a study that shows anything like that, if that was something that you found in your research?
The studies I found were more directly related with increasing connectivity equals increasing bikeability and walkability, especially going to parks and recreational facilities. And I didn't see any monetary burdens, and the countries I was looking into were like in European and in cities here in the US, and they have like seasons. So I didn't read in any of the studies any.
I think that literature is probably beyond the review that they did, because I know some of the winter mortality and heart attacks from shoveling snow and the type of exercise. There are some studies out there that talk about that. So I don't think that was in your review. This was much more of a, the benefits from less pollution, less noise, increased social capital and cohesiveness and community mental health benefits, and the physical fitness benefit. And again, just for context, to put sort of the bookends on this presentation, remember that this was a health impact assessment, almost an appendix report to your bronze to silver recommendations for making this a more bikeable community. Lacking in that report was some of the health implications for those policy changes. So hopefully some of the reports, the data that they found, the studies that they looked at, add incentive to making those policy changes, where you can say, well, let's go from bronze to silver, but not just for the sake of bikeability and attracting business and a nicer community, but actually there's cardiovascular benefits and mental health benefits and all the added incentive here, the health rationale for making this change from bronze to silver. So that's, hopefully you'll use this assessment report in tandem with the bronze to silver report and say, okay, here are the recommendations, and here's some added health reasons why those people that aren't so keen on those recommendations, the pros and cons, well, there's added incentive now to say, well, it's not just so we can have biking, it's good for the health of the community as well. So hopefully that'll help out with that.
Well, I think what you've done will be a good guide for us in that direction. You've taken a very broad topic and customized it to our community and how you've categorized things. I think it gives us some very useful tools as we make decisions and recommendations for moving forward.
Right.
Thank you for that.
Yeah,
Thank you.
in terms of like equity, I would also say that it also correlates with bringing new stakeholders because, for example, the Wisconsin Bicycle Federation, the BikeFed, they have an office in Madison, and they're really active, and they have organized bike rodeos. I know they have a ton of flyers, and they also have some in Spanish. And so partnering with them will be huge, and they also help go to schools. They teach free classes on safety and helmet, and especially for kids, but also for adults. So I think that partnership will be very valuable, as well as the Wheels for Winners, for example. They give away free bikes for kids who have performed, not only for kids, for anybody of any age who has performed 10 hours of community service. But this is a program that not many people know about. But if these people who maybe cannot afford a bike, they can easily go to this program. They get a free bike, helmet, and lock. So a little bit of education with encouragement, yeah, stakeholders.
You know, I want to mention on the comment Brad made, it might be an interesting health assessment future topic to look at the impact of sidewalks on a community, because, you know, when you had the section in there on how, you know, well, biking is not all, you know, fun and games and good health. You also can get injured, and there's the potential to get killed in a collision. And I'm an avid biker, so like I'm all too aware of all that. And but of course I bike knowing that there is a risk, and I also go out and shovel my driveway knowing that a good friend of mine had a heart attack doing just that. So I'm cognizant of the risk, but I'm also grateful for the exercise I get when I go out and shovel my driveway. Because I don't particularly enjoy doing it, but I feel a lot better after I've gone out there and moved all that snow around. So my point is simply that, you know, a lot of these things, it's a more complex story. And it would be interesting to, you know, to look into that as a future topic. Just as someone thinking of this as a public policy.
And this is where, you know, the engineers and the urban planners, you know, there's a right way to do this and a wrong way. And sidewalks are great for walking, but not great for biking, and there's some risk, and there are all sorts of plans to learn from Europe and all over the place that is beyond the expertise of this class. That's where, you know, there's a safe way to do that. There's an optimal way to get the exercise and optimize safety. So I leave that to the other experts.
Well, what's nice about your presentation though too is it's provoked some other side tangent thinking. So I was just thinking when you talk about equity and who is impacted more by health problems, we don't have really great ways of getting across to some of the major healthcare facilities here. And it's just interesting. Hopefully we won't need as many, but you know, it's just another interesting thought, you know, and so that leads us to other questions, I think, which would be, and I appreciate that because yours has been a very lovely presentation, I think.
I'll just say one comment that some findings some studies they found that you think about more bikes on the road, potentially more injuries. Well, there's a certain threshold. You get above a certain number of bikers, all of a sudden drivers wake up and expect them, and so you sort of get this dip in the rate of injury and with more bikes. Yeah, Brad.
Did you, when you read through and you combed through all the sections of the Going for Silver report, just as a way to maybe weed these things out in the future when we look at the report again and suggest policy changes, infrastructure changes, etc., did you find anything that maybe was suggested in the report, but then through your research found that it doesn't necessarily work very well? I know you said that these mass events, not necessarily proven to, in long term, increase the amount of bikers and and stuff like that. Did you find any other suggestions, policies, recommendations that were like, well, not necessarily, they don't necessarily do what they say they're going to do? Especially in terms of health.
But it increases, well,
Yeah.
I think it was more like neutral results rather than negative. I don't personally found any negative results, but there are some that increase, for example, it doesn't increase ridership directly, but it increases safety, which further improves some other sections. So I think, for example, in the engineering section, most of them were positive, but there are some that should be prioritized for sure.
Yeah,
Yeah, and even with like the mass community events, they didn't increase the amount of physical activity and the amount of biking, but people did report feeling like a feeling of being part of the community more so. So that increase in social cohesion is still a benefit, although you might not be getting the direct result that you want of increasing biking and physical activity. You still do get that social cohesion, which is important for mental health. So I don't think there were any that were like completely negative or had no.
but there are some that you get all of the benefit and some that you get one, but maybe not the other.
Right, yeah.
Okay.
Well, I think a lot of it too is just like the engineering in Monona needs to be there before a lot of the other things can make a difference. You know, if there's not decent bike lanes and like places that people can bike or places that people can walk, even if they're encouraged to, like that's discouraging them at the same time, you know? So it's kind of, that's why we decided to put the engineering at the top, because you need to have that infrastructure there, at least like more adequate infrastructure before you can really get a lot of people.
You know, that's interesting to hear that, because then on the other side of the fence, there's the argument that you need the demand
Yeah.
in order to legitimize the installation of said things. So,
Well, I'm sure there's ample research to show that, you know, in communities that don't have safe places to walk or bike, people don't do it. I mean, it's a self-fulfilling prophecy. You can go right around Monona and you'll notice on a nice day, you see plenty of people walking on the sidewalks we have, and not so much on the streets that don't have them. You
There
know.
are people walking in Monona all the time.
Yeah.
Well, yeah, they are, but you see them walking, you really notice them on the sidewalk.
I see them everywhere.
Yeah.
Walking
I would
their dogs everywhere.
I would agree with Leslie, yeah.
Yeah, there's tons of walkers. The thing I would like to say about the biking, I wish I could bike to work.
Yeah.
But you leave Monona going that way, and it's very dangerous. You know, I mean, so you can talk all you want about Monona and making it a great place to bike, but if people don't have anywhere to go,
You
It
want to
does.
talk
Right.
about connectivity and maybe the
Right.
Madison linking.
Yeah.
interlinks
Yeah.
things.
And also like multimodal transportation, so not only biking, but if you can potentially bike and then catch a bus, then that will provide great benefits. If you can bike for 5 miles a day or a couple of times a week, you don't have to do it every week, every day of the week. But if you increase the your ridership by 2 times a week, or it really helps.
But in the bronze to silver report, I assume that they talked about sort of smart city design and having destinations so that if there are weak links into Madison, if those aren't good enough, being able to safely get to the Madison bike trails and then the express lane right in.
or going the other direction. I mean, some people work in Sun Prairie, and I work, just across, 51.
And
it's-
51 is a major hurdle for
And
walkers
it's
and
very-
bikers.
So
There's
that,
no way you can get
I
around
think
it.
what would be good to do a survey of, where do people,
Get
are there
stuck.
foci where people go to work or other things? It's like, and if you have these hotspots, can you make sure you have a decent, safe bike route to those hotspots, at least, those high demand locations?
It would be nice.
Again, I defer that to an urban planner.
and we will, like I said, parallel that with the GIS courses, because their database and their data that they produced has a lot of that in quantitative format. It's in a format that you can actually give grades to streets. And it'll help a lot. It helps reasoning. Because when you say the street is bad, it doesn't work like that. You say this street is a 4 out of 10, and the next street down is a 7 out of 10, and the street before it was a 7 out of 10. But this is the barrier to getting from A to B, or A to C.
Yeah.
Then you can say, okay, then that would legitimize maybe making this a better connected network. So, anyway.
I think one thing for us to take away from this too that is indirect is there are other things in our sustainability plan that could also be looked at from a health perspective and see, because there's a lot of connectivity between sustainability from an environmental perspective and the health issue. So I think that's something for our future to, we have further collaborations going on to look into too, other aspects of water or energy or food.
And I'll just say that oftentimes when you're looking at planning, be it for sustainability or just planning for efficiency, far too often the health issue is completely forgotten about. And so part of the reason that these students are doing these health impact assessments is because it's often left out, and in fact there's so much gain. The evidence is enormous as far as, increasing physical fitness. If you can increase physical fitness by, if you get 30 minutes, we did a study, we were doing some preliminary stuff for Wisconsin, 2 added minutes per day of physical fitness for commuting, translates to $30 million in health savings. So,
It's amazing.
and chronic diseases, heart disease, and obesity-related diseases, and some cancers, as you guys mentioned. Physical fitness, let alone the air pollution and the noise issue, but physical fitness has enormous health gains, and they're so overlooked. So that's why the class is health impact assessment, because too often it's forgotten, but hopefully that will be incorporated in your plans now. Think health first, right?
Yeah, right, absolutely.